Welcome back to Face the State. I'm Ariana Bennett. Thank you for keeping it here. Now, the kids are back in school, and along with homework, they're bringing a lot of germs home with them as well. Cases of COVID in particular are up, and at the same time, if you want the vaccine, it is getting harder to find it. So Chad Kingsley with Northern Nevada Public Health is here with me to talk about that. Chad, thank you so much for coming on the show.
Happy to be here.
All right, let's start with what's going around. What are you seeing?
So we are seeing an increase in COVID cases. We see it in our neighboring states, especially California, it's been reported. But we are seeing intake. So we measure it in different ways by hospitalizations. We also test our wastewater, and then also just reporting through our healthcare system, and all those numbers are rising.
Okay, so I think, there was a lot of concern about COVID, obviously, early on. It feels like the fear has subsided to a large degree, but some people are still being hospitalized?
Yes, they are. So there's still hospitalization. You still see that with flu and other diseases as well. But there are still hospitalizations, and there still it can be impacted. So it just depends. When there's a new variant too, how effective was the previous vaccine to that. So a new vaccination would help us be more resistant to it.
Okay. Now, for those who want the COVID vaccine, it is getting harder to find. There's a few reasons why. Can you kind of go over what's going on with the COVID vaccine?
Yeah, so we're kind of at the end of a cycle with the COVID vaccine. The new vaccine for the new variant that's out was released recently. And so now we need to put in orders to receive that, and then usually we'll coordinate with October 1, which is the beginning of flu season that we kind of measure. Our pharmacies currently do not have any more of those vaccines. Northern Nevada Public Health does have a limited supply, but we also do recommend that the new vaccine would be more efficient or better for you to take, because it does have the new variant in it. But if you have not received it and you are concerned, we are able to receive it both for adults and children at this time. Some limited supplies, but you can contact Northern Nevada Public Health to see if have that, or you can wait until we understand if we're going to get it. Now, on the new vaccine, there are some challenges. We know there's a lot of challenges at the federal government right now. And so here in Nevada, we're one of 3 states that the pharmacies may not be able to buy the new variant vaccine. And it puts us in a challenge. What is occurring is that based on our statutes and our administration code, in order for the pharmacies here in Nevada to purchase that vaccine, it has to be approved by the CDC and what's called ACIP, which is the Advisory Council on Immunizations Practices. And that they're going to meet on September 18th. So we'll know then what the ruling is. Some challenges is that we have the CDC recommendations, which were changed, and we have the American Pediatrics that have different recommendations. And so it kind of puts a centerpiece, since we're kind of waiting to see what the ruling is going to be on those guidelines. So there is a small chance that the pharmacies in Nevada would not be able to purchase it. I think we're all hopeful that it won't go there. One of our best avenues to accessing vaccines recently has been pharmacies. But there will be changes too on some points on who can get that vaccine.
Yeah, we're hearing new guidance saying that it's only approved for people over a certain age or people who have underlying conditions. So even if you want it, you might not be eligible to get it unless you pay out of pocket?
Yeah, and even then, out of pocket is in question too. We're going to have to ask some legal questions and help understand some of the rulings recently towards that. But yes, 65 and older, so the CDC guidelines that were put out, and anybody has an underlying condition. Now, those underlying conditions, there's a lot of them that somebody can access. Previously, what an individual could do, they could come into a pharmacy or they could come into the health district and sign a waiver saying that I'm telling you I have a pre-existing condition, and we'd accept that. That might not be able to be accepted now, so we have to look into that. So you would need a prescription from your doctor would verify, yes, you do have one of the underlying conditions that would qualify you for it. So it would add another step to an individual that perhaps is not 65 or older that would like to access it, and would add one more healthcare access point that they would need to accomplish in order to get it.
Do you think that serves the public interest?
It does not. So public health is about access to care, and we always want to increase. And so We have challenges when somebody is underinsured or not insured. They will tend to start to use emergency care or urgent care as their primary care doctors. That puts burdens onto our economy, onto our healthcare system, on what we can respond. So we always want to be able to connect somebody with primary care providers, that know them and that can be able to provide the best healthcare for them. So it will provide challenges and is not in the best interest of our community for those points. We always want to be able to have the least barriers we can for somebody to access care.
Is it your position that most people would benefit from still doing the COVID boosters?
Yes. So at this point, again, for that individual, yes. And I would say healthcare, a doctor would recommend it as well. That's where the recommendations are. Vaccines allows us to go to work and be healthy, our children to go to school and be healthy. And so it drives our economy and helps us also have a better stable and longevity within our life on those points. And we can see the benefits of how we've benefited from that from history into where we are now and those things that allow us to progress forward as a community.
In the meantime, we're seeing some states going the opposite direction. Florida recently decided to stop requiring school-age children to get vaccines. Things like measles and polio are included in that kind of list of childhood vaccinations. What do you expect to see coming from a policy change like that?
Those policy changes are they based on evidence? And so is this going to be an experiment for the state of Florida to see if their numbers go up or if they stay the same? And they don't have that evidence, so in a sense they're doing their own clinical trial. But we have evidence that shows us that when we use immunizations and when we have these standards, we have a stronger community, healthier community, and a healthier economy as well. We're a tourism-based economy too, and so health is very important to us here in Nevada, both for those that are in our service industry, and for our tourism that come here. They want to be able to come here, enjoy, and leave healthy. And so it's a practice for us that's very important to continue that. Other states are taking that route. Are they going to provide the education and information that's needed to those individuals now that perhaps wouldn't be required to have it?
Yikes.
Yeah.
Okay, so for those who are watching this feeling a little freaked out, what is your best advice for keeping everybody healthy?
So we always go back to the standards, right? Wash your hands. If you have symptoms, don't go to work. Remote options are wonderful now, and many employers do provide those. And especially if you have an underlying condition, then take better care of your health and be more mindful of where you're going, at what times, are there more people around. And so we do have a dashboard that's available that is updated, and you can see all the respiratory that is occurring. So when you see that certain diseases are increasing, there's a chance for infection, just know yourself and your community and take those steps. So wash your hands, watch for your symptoms. If you get symptoms, go to a healthcare provider and treat as early as you can those symptoms, and just be mindful of those things. If needed, we might be hearing more about masks. That is a barrier method. It's just a simple way for us to be able to prevent spread. And if the individual would like to use those, that is an option as well.
Oh, nobody wants to go back to those days, Chad.
I agree. So there's challenges and stuff for that, but they're there. So and I think we've learned from it and what we can do. So.
Okay, and again, if people want to get the immunizations that they haven't gotten yet, whether it's COVID or flu season coming up, where can they go for all that information?
Flu is definitely, so again on our website, you can go in and sign in there. Flu should be available October 1st within our pharmacies. COVID, we're gonna have to wait a little bit, just see where it is. It might be a little bit right after that. They can do it. You can always access it at the health district. We will have some challenges. So previously there have been changes in the federal government, and we did have some clawbacks. We were able, usually on average, we did about 12 outreach in our community. We're down to 1 now. And so, but we're still available at our site that we can go, that you can come and receive vaccines at the Northern Nevada Public Health. So that and your healthcare providers are also able to access those vaccines and deliver them as well. So.
Okay, and we just have about 30 seconds left. Final message, you think it's worth it to get it?
Yes, vaccines are very effective and they keep us safe, and they to keep us safe and healthy and our family happy. So,
Okay.
yeah,
Chad, thank you so much. Really appreciate your time.
glad to be here. Thank you.
Well, that is it for this episode of Face the State. But for more information or to see past episodes, you can head to our website. That's 2news.com. Thank you so much for being with us. We'll see you next week.